Hello everyone, I am Dr. Guruprasad Peruri. I am a neonatologist and pediatrician by profession. I am the faculty for NEET Super Speciality Pediatrics Pediatrics. We all know NEET Super Speciality Pediatric result is out, and our students have performed extremely well in this exam. So now I would like to introduce to you a special guest, Dr. Sarat, who has scored 289 marks and stood 33 in the NEET Super Specialty Pediatrics exam. A special thing about him is actually he's a friend of mine, and almost we are of the same batch while doing pediatrics. He was working like an assistant professor in a medical college, and in the I think about 5 to 6 months before, he had a thought of doing a DM in critical care. I think at that moment he started preparation, and within a short span of time, that is within 6 months of time, he could crack the toughest exam as of now with a very good score. That 289 with a rank of 39 in the first attempt is something impossible, which he had made possible. So let us know directly from him what is his preparation strategy, what kept him motivating for this, etc. from his own words. Dr. Sarat, how do you feel now?
Actually feeling quite happy. It's been a long time since I cracked an entrance and tasted some sort of big success like thing. So I have to say I'm a little bit proud of myself, if I can say that.
Definitely not.
Anyway. So basically, it's been a long time since I have given any entrance exam. So after I did my PG from 2015 to 2018. Initially, I never had that idea of going beyond that post graduation. After PG, I thought of बस हो गया इतना ही काफी है and उसके बाद and after that I never really had the thought of going for further studies. But once I was in this institute and all, obviously people were asking about a specialist and all. So obviously public are getting more and more aware, and in the foreseeable futures, everybody will be looking for super specialist.
Yeah. Definitely. In the down the line, in the next 4 to 5 years, pediatrics will also become like a medicine, a branch of subspecialties. Without that, at least a fellowship or some specialty is definitely needed for you down the line to have a different difference from other people.
That I realized it little later.
Okay. Nothing is too late. Age is not a number. I strongly believe this. Okay. Next, one more thing, like which specialty you are going to choose, so and why did you choose that branch?
Basically, I'm thinking of this thing, pediatric critical care in a good institute, pediatric intensive care, as there are not many intensivists, proper intensivists. I mean, fellows are there obviously in my the place where I live. There are not many intensivists, so I think doing a pediatric critical care for 3 years will give me a slightly edge over the others who are either general practitioners or that fellows. So that I think I might have somewhat edge if I go do that 3 years course. I will be in a good institute. We will be seeing a lot of different cases and all. So lot of variety cases. So so obviously that procedural head procedures also, if you get that expertise in the procedures, you will have slightly little edge over the others, obviously.
Yes, that's true. People are very curious, like what books did you read? What was your preparation strategy?
Nelson only, as I know, I'm a DNB. I couldn't crack MD at during my post graduation, so I had to compromise. It's a sort of compromise like thing with that DNB. So that I don't have any regrets as of now, as I think I have studied much. I passed that DNB. Passing DNB is a little difficult, as you all know, but somehow I made it. And for DNB, you have to read Nelson only. Otherwise, without Nelson, we can't pass that DNB degree. That helped me. So that revise, Nelson is the only book I studied. Nelson.
Then within a short No, I personally know you that you are preparing for the last 6 months only. That within a short period of 6 months, how could you revise?
No, revisions only. Revisions mainly these. Whatever reading Nelson, you will be end up nowhere. I think there is a lot vast. Let us see a simple topic like Von Willebrand. This is Nelson will write so too much. So we have to know how to approach a question and all. And I have to say this Guru Prasad is you are my colleague. You are my batchmate during your. So you have gone too far, and I stayed little back. It's okay whenever there. So that the questions and all, basically we have to know how to answer a question. Everybody after completing specialization, after getting MD or DNB degree, everybody will know everything, but answering the question is a different ball game. Answering the question and excluding that options, and that's why you need some coaching. I definitely say you can't go without any writing grand tests. We can't crack exam without writing grand tests or taking some help from the others who did it.
Yeah, definitely.
The others who did it. That's what most of these coaching they are given by these specialists. I'm not telling that they are bad. They are also good. But rather than that MD, the person of only MD or only specialist degree, rather than getting coached by him, getting coached by someone who has cleared, that is neonatologist or intensivist, will give somewhat slightly. That's what I feel. So, as you know, Guru Prasad has cleared that DM neonatologist. So his experience also came useful, especially in the pediatrics center.
Okay. That is very nice of you giving some credit for me also.
No. You deserve the credit.
Okay, thank you very much. So, just one more question. Like during this journey in the last 6 months, did you doubt about yourself, or did did you feel low, and what kept you motivated to keep continuing this?
Down it's common for anyone. For anyone to feel down or depressed, especially in a profession where you spend 30 years studying, but you still get paid less than your counterparts, engineering counterparts. Obviously you get depressed. You can say money is not everything, and that's only for to satisfy yourself, but ultimately people are going to judge you by the amount you paid at the end of the month. So I felt this little low whenever some procedure could not be done, whenever we get fixed in some diagnosis. So that I stay in some northeast state, if you know that. Though I am from Andhra, I stayed in a northeast state. Here facilities are not that well, so most of the time we will be the only ones managing that patient. Somewhat that the diagnosis gets this thing we couldn't come to a solid diagnosis. Then I feel that I should have done something more after post graduation. I should have if only I had some super specialist degree, I wouldn't be get stuck in managing the child. I would have done little bit more to my patients if only I had this super specialization degree. That made me basically to go through that. I never have written, as you already told, I have never written this pediatrics super specialty exam. This is my first time actually. This is my first attempt. So basically those grand tests all that helped me very much. Last 10 days I have done the grand tests and the explanations only that has done to consolidate what I already know. That is what I'm saying.
Yeah, that's absolutely true. So what advice would you like to give to someone like who is doing MD pediatrics right now? And second thing is, what advice would you do to someone who is practicing outside, who is out of this after completing MD pediatrics, who is out for a long time and still wants to do a super specialty? So what advice you would give to them and help them in getting this super specialty, maybe DM or DMB, whatever it is?
First of all, I think it depends upon the place they want to work. If they want to work in some villages and all, doing the general practice, that will be enough. I think that is my opinion only, not
Everyone's opinion.
That I am not imposing on anyone to do super specialty, because that is individual perspectives. Some people will be fine with doing the OPD, giving vaccines, etc. But I am thinking of staying in metros and big cities and all. So obviously I will be needing something little more to get that. So I think it is individual perspective. But if you want to treat patients better, definitely you have to do super specialty. If you want to have better outcomes of the patient, let us say a 800-gram baby, 800-gram baby, you already know. I think you are a expert, so I am no one to tell you all these things, but I think that is what I feel. Let us say 800-gram baby, the outcome, whether it is neurodevelopmental outcome or it is clinical outcome, it will be the 800-gram baby managed by general pediatrician versus a neonatologist. There is lot of difference between the patient managed by that general practitioner and neonatologist. So only we will know, only pediatricians will know. So be it anything whether protocolized approach or so. Obviously I think I strongly feel serious patients, not normal patients, serious patients managed by a super specialty has a lot better outcome than a managed by a general pediatrician. Again, that is conditions apply. There are many doctors who are general practitioners who are superb, who are very excellent in that practice. And that is again, that is individual. But for younger generations like us, we are almost, if I can't have myself young, I don't know, people may get offended if if I call myself young. But I think we shall need that super specialty degree.
Okay. My question is like, what advice, like how should any student doing DNB or MD study to crack this exam? Like any study tips you want to give?
Study tips, after reading that, I think working out the questions is an important thing. That's what I feel. Working out, you can read entire day. You can read hematology for 1 month, but you can't answer all the questions if you are given that in the exam. Okay, I think working out the questions is the main thing. Excellent. Everybody knows. Most of the pediatricians, let us say that case of ITP, most of the guys will treat that case of ITP. But if a question comes, the question also came in that, but attempting the question is a different thing. So I think they will need someone to guide them. Okay. I think they have to answer the questions. They have to work out the questions, topic wise, whether it is topic wise or grand test. They have to attempt the questions, see the MCQs, how to rule out the options and all. What points to remember in that MCQ point of view, clinical point of view and MCQ point of view. That's what I feel.
Okay, great. Now, your personal question, like which institute you are going to take?
That I think I'm thinking of taking.
Tell us 3 institutes which you want to take.
Okay, Kash. In the main counseling also they give seat like this, I would be very
like
I'm waiting for the options.
You have to tell the names. Like you should only tell, because only
basically I'm interested in the pediatric critical care only. I'm thinking of this St. John's Bengaluru and this Narayana Hridayalaya or Gangaram.
Yeah, good. Okay, we hope definitely you will get whatever you want, and your future is bright as always, and keep inspiring all the people. We wish
you are inspiration to not.
Everyone is an inspiration. Okay, very nice speaking to you, Dr. Sarat. All the best for your future.
Thank you so much.